You can't see it and usually can't feel it. According to the American Heart Association, more than 79 million Americans have cardiovascular disease. It remains the nation's #1 killer.
Cardiovascular disease still kills 40 to 50% of the American public. It is so far more than any other disease process that it is truly a staggering mountain that we have to climb to cure it.
But even simple changes can help fight heart disease. The Cardiovascular Institute at Beth Israel Deaconess Medical Center offers these 5 steps. First, know your family history. Even though you can't change your genetic makeup, family history is an important indicator of your risk of heart trouble. Learn not only if your parents, siblings, grandparents, and others had heart problems, but when.
If they had it in their older years, in their 70s or 80s, that's very common, and many people have that. But to put yourself at risk for having heart disease at a younger age, it's really having a relative that's had the disease at a younger age.
Those with a strong family history of heart disease may need to see a doctor more regularly for tests and checkups. Second, eat a handful of nuts every day. Diet plays a big role in controlling risk factors like blood pressure and cholesterol, and adding a 1/4 cup of unsalted walnuts or almonds could serve a couple of purposes.
Nuts are great. They offer some healthy fats, which might increase the good cholesterol. They offer fiber, which is always good for lowering cholesterol, keeping yourself full, to hopefully monitor portions better. And they also incorporate some protein in your diet.
Next, skip the elevator. Take the stairs. Not just once in a while, but whenever you can. The American Heart Association recommends 30 minutes of exercise most days of the week, but that time could be split up into 10-minute intervals. Every step adds up. Also, know your goal weight and work out a plan to reach it. Extra pounds put more stress on your heart. Being overweight also increases the risk of high blood pressure, cholesterol, and diabetes.
Even a small weight loss, even 5 to 10% of weight, will have an impact on some of the different risk factors associated with heart disease.
And finally, see your doctor every year. Blood pressure, for example, can slowly creep up, and catching hypertension early is key. Your doctor can decide which tests you need each year.
Keeping on top of it with a regular check with a professional is important.